Efforts underway to save lives in a conflict zone that's already seen more than 40,000 lives lost.
من يوم الأحد 1/9 وحتى يوم الأربعاء 4/9.
That's UN staff alerting families in central Gaza to the launch of a new rollout of a polio vaccine. The video comes from a freelance videographer hired by CBC News. The vaccination campaign is aimed at 640,000 children aged 10 and under. Doses have been rushed into the territory following confirmation of the territory's first case of polio in a quarter century. They will be administered in 3 phases across 3 regions during humanitarian pauses in fighting. A booster will follow in 4 weeks. For more on this, I'm joined by Naina Bhalia. She is a medical team leader with Médecins Sans Frontières in Gaza, and we reached her in Al-Mawasi. How is the first day of the rollout going?
It's not the best conditions to be trying to do a vaccine campaign. I've been involved with MSF for a number of years and been involved with a number of vaccine campaigns. This is definitely the most difficult situation and context to try and undergo a vaccine campaign. Nevertheless, families are showing up with their children. Children are getting vaccinated, but it is a drop in the bucket, a drop in the ocean to what is needed here.
Can you just break down for us what role MSF is playing in this vaccination rollout?
So MSF across all of our sections have multiple primary health care centers. We are working in hospitals and have 2 field hospitals that are about to open. We are supporting the Ministry of Health, UNICEF, and the WHO, who are spearheading this campaign by helping to provide organization and logistical support so that the vaccine can be given in over 700 medical points, primary healthcare centers, and shelters, of which we are participating approximately 10 of those points and health centers.
It's a massive undertaking, 640,000 people, as you say, and what you've been able to reach so far is a drop in the bucket compared to what the job ahead is. 90% of the children under 10 must be immunized so the campaign can be effective. And of course, there's urgency here too. We've been hearing from medical personnel who say this needs to be done in a short period of time to avoid this virus mutating as well. How hopeful are you that you'll be able to meet this target?
I think, as the Palestinian people here every day say, I'm still alive. So we are just trying to make sure that that continues to be the case for these Palestinians, especially these children. We are really trying hard to meet the target, but with the constraints of security, continued evacuations, especially in the past 2 weeks, continued populations, including our staff and the health care workers that are participating in this vaccine campaign, having to move under very short notice, areas of the humanitarian zone being shrunken, and continued fluid movement of the population with continued fighting, and only being able to have really all the Israeli government has agreed to is 3 days with 1 day of catch up, and having to do it in different zones at different times makes the constraints even harder. So we will do the best that we can. We are very hopeful, but it is a very, very difficult task, to say the least.
Yeah, you mentioned the safety and security issue there. And in the past, we have seen humanitarian groups caught up in this conflict and sometimes with tragic consequences. How confident are you that you and your teams can carry out this work safely?
We are hopeful that the Israeli government will respect the humanitarian pause that they have offered in the zones while we are trying to administer the vaccine to these children in these zones. But we have to be reminded that I can say, just from my standpoint, the amount of increased military action over the past 2 weeks is impressive. The amount of fighting that is continuing to happen, the amount of evacuations that have happened over the past 2 weeks. This not only affects the populations and the families that need to bring their children to get vaccinated, it also affects the healthcare workers. Over 800 healthcare workers have died since the beginning of the conflict. Over 300 have been arrested, and healthcare workers are still showing up to work every day trying to do this. There are still, as everybody has seen in the news in the past week, a number of targets on humanitarian convoys and the WFP car. Not only that, even MSF, there was a targeted drone attack on the only road that is connecting these different zones in Gaza. And there was a targeted drone attack on the road where our car that was clearly marked on the roof as an MSF car was less than 60 meters away from the drone attack.
Wow. The safety is one challenge. The logistics are another. We know these vaccines need to stay at a certain temperature. You're dealing with things like damaged roads, densely populated areas, health services under the kind of strain that you've mentioned there as a result of this war. What do you make of the logistical challenges that you are going to be facing here in this rollout?
Yeah, every morning we're just even trying to communicate to our staff if the shuttles that bring them to the hospital and to their places of work will be running based on security that we receive overnight, and if the staff can come to work. Many staff cannot show up because of evacuation orders that affect them and their families. The logistical part of this is also going to be a major undertaking to be able to make sure that the vaccines arrive at the centers on time. We have a very limited time frame. Only 9 hours per day have been agreed upon by the Israeli government for these humanitarian pauses. So to try and immunize over 600 children in zoned different areas with these constraints and the logistical constraints that we have is a huge undertaking.
Well, we certainly wish you the best in the monumental effort that you have ahead, and I hope we'll get a chance to talk again as this goes on. Naina Bhalia, thank you for your time today.
Thank you for having me.